Okay, well, good morning, and welcome to our webinar today on return to work best practices to keep your workplace safe. I'm John Casper with the Oshkosh Chamber of Commerce, and with us today we have Dolly. Is it Culprit?
It's Clabot.
Okay, with JJ Keller, Senior Editor with JJ Keller, and Jim Macy, Attorney Von Greason and Roper. Timing of this program is right on time, I think. As we all are anxiously waiting to get back to work and getting our businesses back in operation, which appears is right around the corner. I think what you hear today will be of immense help to businesses, providing the guidance to do those sorts of things. So, without further ado, I think Dolly, are you going first?
I think Jim is.
No, Jim's going to go first. So, Jim, why don't you take it away?
Will do, John, and thanks a lot. Just in terms of background, what a week or what a couple of months we've had as far as all of that goes, and Dolly and I are going to help a little bit on the background of this. I'm going to talk a little bit about the legal aspects of things that have been going on, talk a little bit about the Supreme Court case, pieces of that. What does it mean? What are the local requirements meaning? What's going to happen over the next couple of weeks? But more importantly, with information from Dolly as well, about what do businesses do in the meantime with these opportunities to reopen? How do they keep things safe? How do they do that to protect their employees, to protect their customers, and protect their clientele and their customers? The reality of what we're all facing is unprecedented, of course, and none of us have seen anything quite like this, despite the other issues we've had come up from time to time. And what we've got now is a goal. Despite all the fights and despite everything going on, we've got this goal from today with this health crisis to the day, hopefully sooner than later, that they come up with a vaccine. Because in the meantime, we've got this competing interest of the need to keep people safe and avoid further spread of the virus and catastrophes that can help. But at the same time, we need to go to work. We need to sell product. We need to have the economy pick up as well. And these competing interests will not go away until we have some kind of vaccine or some other cure. And that's not going to happen right away. So we're going to be in this. And the reality is, from everything that we've heard and talked about, politics aside, everything else aside, between the local communities, between our businesses, and between how people respond and act is really what's going to save us between today and between the day that we get a vaccine and some kind of cure for this. So let's talk about what does that mean for businesses and other aspects. Well, a little quick history with this, and John, I'm going to send out a PowerPoint later. It just is, I just don't think that's going to work to pull that up right now. But the reality is we know that back in March, the governor and through the health secretary put together a safer at-home order that put the brakes on lots of different things other than essential businesses. And then that was extended on April 16th to go until May 26th. The legislature filed suit, as we know, and more recently, the Supreme Court made a decision. Let me come back to that. What I want to mention, though, is that's only one case that was pending, and that has to do, the one that's come down, has to do with really a fight between the executive branch of the state and the legislative branch of the state as to who gets to decide what and to what degree can those different groups put restrictions on us, either as citizens or certainly as us as businesses that deal with how we act in our daily lives. Important to note in regards to that, though, that there's two other cases pending, and those have to do with private citizens that have filed suit under the orders that really also challenge people's rights to freedom of worship, freedom of speech, freedom to travel. And in the recent case, the Supreme Court didn't really answer that particular question. What we do know, though, is within the Supreme Court case, and this was against the Secretary, Andrea Palm, from the legislature. Notice it wasn't from the governor. but it challenged whether the governor, first of all, talked about the governor's emergency powers having 60 days to do things, but that's not what the fight was about. It was to what degree does the Department of Health and Social Services have authority to close things altogether, including our businesses. And it had to do with the authority under Chapter 227 and 252 over their rulemaking authority and their ability to pass emergency rules. Bottom line is from the legislature, from this case, 4-3 decision, that the secretary broke the law when she issued the order by failing to follow the statutory required emergency rule procedures. In other words, an agency can do it, they just have to follow certain emergency procedures, and she didn't do that. I can tell you that as of yesterday already, that agency has already initiated the initial steps of following the emergency rule procedures. So you got to anticipate that that's going to move forward trying to correct that error. Court also said that even if there's not, if the emergency rules weren't required, that she exceeded her authority in several important ways. And she said by ordering all people to stay home, that was a problem. Closing all non-essential businesses was a problem. Prohibiting private gatherings was a problem, and prohibiting all non-essential travel was a problem. In other words, emergency rules aside, she exceeded her authority in these other ways as well. That's important because I said, even though the agency started the emergency rule procedures, there's still part 2 of this problem that they're going to have to try to cure. Argument 3 from the legislature in the case is really important too. The Supreme Court didn't decide this issue, but it had to do with the constitutionality of all of these kind of things and to what degree were those rights violated. Again, the court said we don't need to decide that yet because, quite frankly, we can decide on other grounds, and that's what the Supreme Court does. Essentially, another important point here is the legislature also said we want a stay. Give us 6 days, X days, that we can then meet with the governor, get up to speed on a joint solution to this problem. And the Supreme Court said, no, we're not going to do that. This is your problem, governor and legislature. You've had 14 days since we started this case to get together. We're not going to solve your problem. You get together. You may have been following the news on this, that they're getting together, but nobody anticipates any great solution from the legislature, from the governor to cure this problem. All right, what does that mean? All right, now it goes back down to the local counties and the local health agencies to decide whether they're going to come up with orders. Similar statute that was litigated at the Supreme Court level for the state agency. Another provision within that same statute gives some similar authority to local health agencies. So what we know that counties like Brown County, Outagamie County, for us, Winnebago County, couple other counties across the state have basically duplicated the prior state order to put it in force for some of the local communities then. Is that going to be legal? Time's going to tell in regards to that, because quite frankly, it's a real similar analysis and a real similar statute that was just tested. I can tell you that the Attorney General put out some information to suggest there may be limited authority through the DA's offices. The sheriffs have weighed in a little bit to say they may not be pursuing these actions if there are. So that puts it back to say there may be orders, but they may not be appropriate. I know that Winnebago County, in some discussions with them, the county board hasn't acted. There's issues within that order to talk about criminal penalties. Those are all challenges that are still open for debate. And some suggest that that's not going to be enforced. Some suggestions, at least the request is that that's going to last until the 20th, till next week, and may not be extended, but we don't know that yet. So, but for now, it's kind of back to the municipalities. It's not all municipalities. Fond du Lac County on the other end said, we're not interested in all that litigation. Quite frankly, we trust our businesses are going to make right decisions. Bottom line as to whether it's going to be today, whether it's going to be next week, or when it's going to be, businesses need to be working on what do they need to do to reopen and to do that safely. Before I turn it over to Dolly, I want to mention a couple other things. Businesses have been doing things and there's always a risk in being in business, whether it's potholes in the parking lot to allowing smoking to all the different issues we've had over the years, whether we follow OSHA guidance and other guidance that are out there to limit exposure and to limit liability. From a very basic standpoint, you always look at, do we have negligence? And do we have negligence to the degree that we open our business and we're not safe? Clearly, there's all this guidance out there in terms of taking safe practices, and that's going to fold into any kind of negligence aspect. Do we have a duty of care? Of course, if we're opening our business to the public and with our employees, we have a duty of care to them. If there's some problem later, did we breach that duty? Is there a connection between the harm that occurred? Somebody gets the virus, and is there actual injury to that because of what we did or we didn't do? That's why the guidance is so critical as to the information that's coming out from the chamber, that's coming out from the CDC, that's coming out from OSHA. You clearly want to use all of that you can to help you through the negligence standard. And just like any other time in your history of business, that if you're going to open, you're going to take risks, and are you doing that in a safe way? Again, there's lots of guidance. One other, and again, I'll send the information out to folks, is OSHA puts out a really good guidance piece on preparing workplaces for COVID-19 within their publication. And they talk about the different steps that employers can take along those lines. And that has to do with having a preparedness plan in putting together communications with workforce flexibilities for employees, protections, what kind of workplace controls they talk about with that in terms of engineering controls, how we set up the workspaces, administrative controls, how are we dealing with leaves of absence and people working together. Very specifically, what kind of distancing are we doing on the actual safe practices? And Dolly will get more specific about this. And PPE, the different equipment, the information the chambers put about, all the different suggestions and things that employers are doing now, companies are doing now, are all great resources for everybody here, all over having to do with eliminating the negligence or the liability pieces. So regardless of the fights going on with the governor or the legislature or the others, our goal as businesses is to have a safe, good environment. I don't know of any employers working with them and working with the chamber all day, anybody wants to create something that's going to be unsafe for their employees or for their customers. Go out of your way to use the advice that's out there in regards to all of that. Consider having in place a return to work plan for your employees that talks about daily assignments, that talks about to what degree we're going to do work at home or staying at home, how you're going to deal with those kind of things, what are the employee reporting requirements, how do you deal with a case if you get a confirmed case. What are you doing on your training and practices and procedures before you ever open? Every day that you open, do you have a routine to make things are safe? And while you are open, do you have a routine to make things are safe, both for your employees and for your customers? It's liability, and it's nothing new. We got to get from today to the day that we get a vaccine, and to use use the 2 months that we've had, or 6 weeks to 2 months that we've had, and all that we've learned in a short amount of time, put that together, and let's challenge each other to do the safest we can and make it a good situation that can get us in convincing people it's not the Wild West out there, that we are not stupid people, that we are not running helter-skelter, that we run good, safe businesses that are good for employees, that are good for our customers, and that we can do both. We can deal with the health crisis, And we can run an economy and run profitable businesses. And that's our challenge, and that's what we're going to do. Dolly, let me turn it over to you with that background and anything else that you'd like to add within that.
Thanks, Jim. That was very well said. I'm just going to go into a little more detail on those kind of aspects as we go along. Instead of looking at my picture, I'm going to share my screen. And hopefully it'll work. Don't need to look at me all the time. Share. Link. Come on, work. There. Everybody can see the screen? I hope. Well, first thing we're going to talk about is the communication. As John mentioned, it's very important. As basically, if you don't communicate to your employees regarding your return to work plans, they're going to fill in the blanks, and usually going to fill it in with the worst case scenarios. And we've all had enough surprises, and communication and what employees can expect can help avoid more surprises. Good employers are already telling employees, what is your plans? Even if those plans are destined to change, just keep the employees in the loop. Let them know that, yep, we're kind of still working out the kinks. So it's okay not to have the final answers, but give employees the information on when you plan on bringing them back, which employees might be first to return. Let them know what they expect when they do return. Will the physical workplace have changed? If so, how? Will the changes affect the employees? What about cafeterias, break rooms, conference rooms? Will they be off limits, or will they have different rules? Will you be performing employee health screenings? If so, when, by whom, how, and where? All these sorts of questions should be addressed to some degree. And that's all done before you begin to bring employees back. In some cases, the simple little things can make a really big difference. If, for example, you usually had a kitchen area where employees gathered, getting the coffee and stuff like that, if that's not going to be prohibited and only one person will be in the area, be allowed in the area, just let the employees know that. Because we've all had habits that we've developed over the years. And once employees return, their same habits are likely to return too. So some of those habits may be hard to break. You also might consider posting notices or reminders of your adopted protocols in various areas of the workplace. Because keeping employees in that loop will also help them feel connected to the workplace and that your company cares about them. And all that kind of stuff can have an effect on your company branding efforts. So a lot of you might not bring all employees back all at the same time, but bring them back in stages. You may already have employees that have been continually working all along. And of course, the safest approach is to bring back only those employees who are truly needed at the physical work site. If some employees, no matter what level, are effectively working from home, maybe you want to let them continue to do so. That's safe. So as efforts do continue to control the outbreak and these involve, you might consider allowing more. Yes?
Darling, it looks like your slideshow is not working properly.
Oh.
We've gotten a couple of remarks. I wasn't sure if it was just me.
Looks to me like just start the slideshow, either down at the bottom button or up at the top, just to start the slideshow.
Is it working yet now?
No.
Okay, I'll stop sharing.
Yeah, I would say start the slideshow and then restart sharing. That's worked for me in the past.
Except that when I start the slideshow,
Yeah, I think you'll have to start the slideshow and then Alt-Tab back into the Zoom app and share from there, if I remember right.
no, that's not how to work. That's not working either. I can just talk too and share the slide, so at the end, for some reason this doesn't wanna. Stop share. We've all had these really, really steep learning curves, and some of them have to do with technology, as you can see. Share just doesn't want to, just not want to see this one. Okay, I'll just keep talking. I won't waste any more time. But anyway, we're talking about communication. Keep those employees in the loop. Already I did that one. Bringing people back. And also when you want to look at your work site, your layout, some employers might add markings around workstations to identify a 6-foot barrier, because it's really human nature to get closer and closer to people. We're social beasts. It's what we do. So having a barrier could be a simple reminder. Other considerations include closing the areas where employees usually congregate. That includes conference rooms, break rooms, lunch rooms, things like that. Otherwise, you might allow a limited number of people in such areas, assuming that they can maintain the proper distance. Again, a lot of this stuff comes from CDC and OSHA and our government agencies who are fighting this. If you have hallways where people have a risk of passing each other, maybe you make them one-way hallways. If you have elevators, again, that occupancy should probably be restricted. And maybe employees could be encouraged to use the stairs, get more steps in. When it comes to PPE, personal protective equipment, you might have positions that require close contact with others, whether it's coworkers or visitors to the public. And depending upon the level of contact, you're going to need to assess what type and what level of PPE will be needed. And that should be based on the results of a hazard assessment and based on the specific job duties. So you need to take a close look at all the jobs and all the hazards. Employees should also continue to follow the routine practices for PPE that they normally would. And when cleaning and disinfecting, that's when employees should be wearing gloves and gowns appropriate for whatever chemicals are being used. Additional PPE may be needed based on setting and the product. CDC does not recommend the use of PPE in workplaces where it would not routinely be recommended, but facilities can use that, like Jim pointed out, the hierarchy of controls, administrative, engineering controls. These strategies are usually more effective at preventing exposures than wearing PPE, because face masks are not considered PPE. Therefore, employees should wear gloves only when they're cleaning or caring for someone who's sick. In most other situations, wearing gloves is not necessary, and it actually may help spread the disease. Once they become contaminated, they have to be removed and discarded. But the proper hand washing, of course, should always be being done. Now, some jurisdictions, I don't think Wisconsin is one of them, but some jurisdictions do require face masks when around other people. If you're going to require them in the workplace, you need to consider which ones will be required or allowed, who's going to supply them, who'll pay for them, and so on. If masks are used, you might want to remind employees how to wear them and how to clean them. The mask should cover mouth and nose, and perhaps putting up some posters can help with these reminders. And employees who have frequent close contact with customers or the public may need to wear some combination of a face mask, face shield, goggles, something like that. And all this, again, is going to depend upon the situation and the risk assessment. Some employees might refuse to wear a face mask. In that situation, you're going to look at, you want to explain the reason behind that. But if that doesn't work, you could see it as a policy non-compliance, assuming you have a related policy. Now again, all of a sudden you have to start looking at your policies to see how they apply. If you don't have policies, maybe you want to put some in place. If, however, an employee refuses to wear one because of a medical condition, that's kind of your trigger to engage in the interactive process with the employee under the Americans with Disabilities Act. And also if an employee has a religious problem with it, it helps to undergo that interactive process, talk to that employee about what kind of issues. It doesn't mean you have to provide it, but for religious reasons, but you have to really do an assessment. Now, if you're going to be screening employees before they enter the facility, that's fine. And this could involve asking employees some simple questions regarding symptoms or taking their temperature. And because it's a pandemic, the Equal Employment Opportunity Commission is fine with that. And once the pandemic is over, yes, looking at the bright side of things, then this will be a different story. These kind of things are medical inquiries and exams, which are generally restricted under the ADA. But if you're going to do such screenings, you have to do some planning. Where will the screenings be performed? Because they should be done privately. And waiting for a screening could be seen as hours worked, so it means you might have to pay people. Who's going to perform the screenings? What equipment will be used? Whoever does perform them should be properly trained and protected. And the equipment in the screening should be accurate. So you would need to review the equipment. And then when it comes to taking temperatures, how are you going to maintain the distance? That'll depend somewhat on the equipment you're using. If you don't maintain distance, how are you going to protect the employees and the person who's taking the temperature? Also, what's going to be done with this information? Wisconsin Safety Council and OSHA came out and said, you know, if you're going to keep this information, it's a medical record. And so the OSHA record standard comes into play, and you'd have to keep that information for the duration of employment plus 30 years. That's kind of a long time. That's something to consider though. You don't have to keep that information. You don't have to make a record of it. But if you do, you have some more considerations. Now, this is kind of fun because necessity is the mother of invention. And with all these new protocols being called for, technology companies are coming up with some solutions. Wearable devices that alert the wearer that he or she is within 6 feet of another individual, which could also help with contact tracing. Some wearable devices monitor an individual's temperature and set off alarms if thresholds are breached. Some devices screen for individuals not wearing masks. Some offerings track the locations of individuals. Now, no contact devices with thermal scanning capabilities to spot a fever among multiple individuals can also help with temperature screening. Now, whether these tools will become more available and commonplace is going to depend upon their accuracy and their effectiveness. Both need to be addressed. And again, the information gleaned from these tools, if you're going to record it, you know, think of the OSHA record keeping, and you also have to consider that the ADA requires medical information to be kept confidential and also separate from the general personnel file. Now, you also need to have a plan, as Jim pointed out, to have a plan in place on responding to situations where employees test positive. This could require employees to go home or stay home and follow the CDC guidelines before returning to work. Now, if the employee had a test to determine if he is still contagious, he can return to work after all those 3 things have happened. Number 1, he no longer has a fever without the use of medications. Other symptoms have improved, and he has 2 negative tests in a row, at least 24 hours apart. Check with the CDC on these things because they've been known to change their criteria. And if an employee did not have COVID-19 symptoms but tested positive and stayed home, then he may return to work. When he returns to work will depend upon all the facts involved. Again, CDC keeps changing their protocols as we learn more and more.
Hey, Darlene, if I could interrupt for just a second here.
Sure.
On the aspect of if we get a case, an employee calls us and says, I was at some event, I wasn't feeling well, I went in and I got tested, and I just want you to know I've tested positive. So as an employer now, we've got that situation. The first question I usually get is, what responsibilities do we have to report that out? And as I understand it, there are not, it's going to be the medical provider that did the test and came up with that, that's going to report that to the health officials as far as a positive test. So employers, at least in responding to that, know that's not necessarily their direct responsibility. The second piece is, what do we do within the workplace? Can we say, Jim Macy tested positive? No, we can't do that yet, at least from the guidance that we're getting, is to name people under the confidentiality provisions. But we do have a responsibility to notify other employees that may have been within a range of these people. Some of the guidance talks about in contact for 10 minutes to 30 minutes or more as a contact that could generate a reporting obligation to let people know that they may want to watch their symptoms, they may want to be tested. The other thing I can add to that is it really varies from the different health groups. Most are really helpful if we, and as you mentioned, you know, we contact them and ask for guidance. They're pretty good at helping us identify as to who might need to be put on notice, who might need to be sent home, depending on what symptoms they have. But at least I thought I'd interject at least a couple of more, you know, what specifically do we do if we get that bad call that something's happened? And anything else, you know, as you were talking about with that, of course, goes with all of that.
Yeah, very good. You get somebody who tests positive, you don't want them coming into the workplace. Send them home, tell them to stay home. But then again, if they've gotten close to other coworkers, let them know that they may have been exposed. Really good information. Thanks, Jim. And then when it comes to keeping your work site clean, OSHA has a whole bunch of information on there to use EPA approved products that kill the virus. Yeah, there are some things that kill it. And EPA has a whole list, and you're supposed to use those products as directed, and of course use the appropriate PPE and follow the manufacturer's instructions. And the object here is clean and disinfect high touch area surfaces. I've even seen some apps where it's like, okay, I can use my cell phone to open the door. So there's some more technology coming out like that. So you don't even have to touch anything. But otherwise you clean things, tables, doorknobs, light switches, countertops, handles, desks, phones. Don't let employees share these things. Keyboards, toilets, faucets, you know, the whole thing that you normally would be touching all the time. And again, this is when you wear gloves. And some places might want to have a professional service come in and do those sort of things. Lots and lots of things to consider. Now, you also want your employees to probably change their behaviors if they haven't already done so. The hand washing, respiratory etiquette, the distancing, and the cleaning. Perhaps you have policies that you have revised to include these types of employee expectations. That way you can hold them accountable to the policies. And go back to your communication efforts. Feel free to remind employees of these expectations. Put this and other related information on the back of the bathroom stalls. You've got a captive audience there. Tell them about all this before they return to work so they know what to do and what might happen if they fail to comply with those policies. If you have customers and vendors, hopefully you do, your employees aren't the only ones who can enter your facility. If you have people who are from the public who will, you're going to want to take steps to prevent visitors from bringing that virus in. You might, for example, post signage on the front door, letting customers know about the changes to your policies and instruct them to stay away if they're experiencing symptoms or anything like that. And maybe they'll be required to wear masks while inside the building and also to maintain distance from employees and other people. So you might want to consider options to increase the physical space between the employees and the customers, such as a drive-through, partitions, floor markings, things like that. And also it helps to keep hand sanitizer available for visitors and as well as employees. And this is something you think of before they come back to work. Do you have enough? And do you have vendors who could continue to supply that stuff? And if you can handle transactions electronically with the public, that's probably the safest way to do that. That way you don't have any change of diseases. Now, generally when you're bringing exempt employees back to the work, you should take steps to retain their exempt status under the Fair Labor Standards Act. And Jim, if you have any information on the FLSA, feel free to chime in. Will the employees still be paid their minimum salary? And are they performing the applicable job duties per the particular exemption under the FLSA? Otherwise, you could risk a liability for misclassification. And that one might risk having to pay unpaid overtime. Also, under the FLSA, if exempt employees are working only part of a work week at your direction, they're still entitled to their entire salary for that week. So if you plan on bringing exempt employees back on a part-time basis, for example, maybe having them work only 4 to 5 days, they still need to be paid their full salary. So if you're going to make automatic reductions of salaries to account for a reduced schedule, communicate that to the employees before the salary reduction. And if you have instituted changed schedules, even for non-exempt employees, that, communicate that. Evaluate all that fun stuff. And as you do bring employees back, don't forget to make the determination on who to bring back and things like that. Base that on business operations, not on an employee's protected class. You don't want to discriminate on the basis of those things like race, national origin, sex, disability, age, religion, or genetic information. So you might think, go ahead.
Let's emphasize that again, that point again, because this a lot of people on furlough, a lot of people on layoffs. We're going to reopen. We're bringing people back, and many times this isn't intentional. It just sort of happens, but you want to think about that so you don't have a scenario where you've brought back the young people versus the other aspects of things. And I know that seems a little odd, but even when we're doing the layoffs or furloughs, and then when we transition, the same thing coming back, what were the business decisions based on the people that you selected? And just reemphasizing again what Dolly said, but it's so important. Think ahead on that. Doesn't take a big chart or all of those, but that doesn't hurt you as to business reasons as to who's coming back, who's not. Second thing about working at home, going from part-time or furloughed to part-time to full-time, it's going to impact unemployment comp. And one of the challenges you all have right now is with the extra money through the unemployment comp, the extra $600, we got to be creative as to, one, convince people and make sure they're comfortable that it's a safe place to come back, but also economically, the incentive to come back as well. So we can plan, don't do it based on protected categories, of course, have a business reason backup, and then consider in the different incentives as people come back.
You get the nail on the head there, Jim. Thanks. Now, you might have employees, and I'm hearing this a lot. A lot of employees are saying, I don't want to go back to work. I don't want to go back into that place because it's dangerous. So there's no requirement that you allow healthy work employees to stay home from work. And generally an employee who stays home when not sick doesn't have a whole lot of protections from the adverse taken because that employee stayed home. However, you could choose to allow that absence or authorize the use of paid time off for that purpose. Similarly, you may allow employees to work from home again. But if an employee doesn't have either a serious health condition or a family member with a serious health condition and things like that, you got to start thinking the federal and state Family and Medical Leave Act. Now, some people have COVID-19, have no symptoms, and it wouldn't be a serious health condition under either FMLA, but some will. If they're sick enough, you got to start thinking of your FMLA obligations there. And Jim already talked about unemployment. Also, if somebody, a lot of employees are saying, well, I don't want to come back. I have a heart condition, underlying condition, and I'm at high risk. So I don't really want to come back to work. And again, that kind of triggers your ADA obligations because this employee is asking for a change a workplace change, like a policy change, because of a medical condition. Your ADA obligations to engage in that interactive process then is triggered. Now keep in mind, under the ADA, number one, you don't have to provide an accommodation that poses an undue hardship. And you don't have to provide one just because an employee asks for that specific one. Generally, you need to provide one that is effective, but you get to choose which one that is. Now, even the government agencies providing information, they've been starting to add information on employee mental health and well-being, including the CDC, how to handle stress and building resilience. And while change can be challenging, massive changes can have really quite the impact, particularly changes that are beyond our control. Again, I return to the importance of communication. Let employees know that it's okay to be sad, angry, upset, disappointed, things like that. Allow employees to talk to each other about non-work activities, because that connection can help, even if it's just for a couple minutes. Remind employees of sources for help, that they're not alone and that help is available. This could be an EAP or maybe some identified community services. Inviting employees to share funny stories or vacation pictures on the company intranet can also help support a sense of community. And don't forget that you, as employers, you're all people, and you could benefit from that kind of information as well. And if you're not hiring now, you may be in the future. We hope that you will. Usually interviews are done in person, but defining a new method to hold interviews shouldn't be that challenging given the technology of options that are available, like webcasts and things like that. The USCIS is also allowing employers to view acceptable documentation for purposes of the Forms I-9 electronically. Now, employers have to inspect the documents remotely and inspect and retain copies of those documents. Video link, fax, email, and things like that. You still need to meet that 3 business day deadline, however. Onboarding new employees can also have some challenges. Perhaps new employees will begin working from home. Well, in any case, new employees likely have some equipment, need some equipment and supplies, and information can be provided electronically. But you and the new employee will need to work out how to get the employee the material he will need to perform the job. And perhaps a new employee will need to report to the physical facility. In any case, an employee will need to be informed regarding what to expect. You don't want surprises. And that's pretty much all I have at this point in time.
We can certainly open up for questions, but let me add just a couple follow-up thoughts, Dolly, you know, and some of the things that you were talking about. You know, another thing that's interesting is the Supreme Court, we were waiting for the Supreme Court decision to come down. The governor's office slowly put out more information and then slowly started to open up things. But within that was a lot of guidance per industry, per business that they were making suggestions and recommendations for. That's a good tool for people to take a look at as to what was being suggested for particular industries as they do that. For those that have not been open yet, and we're nervous about that, we're nervous because we got lawyers talking about liability and other issues with that. Keep in mind, a lot of businesses have stayed open and they've done just fine with that. So our businesses will be fine too. And you know, for those of us that may have violated the order once or twice and may have done a little shopping once or twice, there are lots of places out there you can go to and you'll get a pretty good feel pretty quick as to who's on top of this and who might ought do just a little bit more. And again, you know, just from a personal experience, when I first started to go to the stores, you didn't see many masks. And if you're uncomfortable about having your employees wear masks, don't be, because quite frankly, that's getting to be not only much more socially accepted, much more recognized, but that shouldn't be a problem. And as Darlene said, you can require that with the exception if there's a medical condition, and we'll deal with that as an ADA scenario. But in 30 some years, I haven't had a couple, but not a lot of those scenarios where we had a medical mask problem as far as that goes. It's just whether people are going to feel uncomfortable with that aspects, but they won't be. If I went to Menards 2 weeks ago, I could just go to Menards. If I go to Menards today, I got to wear a mask. Do you have to give people masks? No, not necessarily, but yes, you can require to come in your premises, people have to wear a mask. You're going to notice, like I said, if you go to Menards, you're wearing a mask. If you go to Costco, you're wearing a mask. If you go to Costco, take a look at all the different procedures. Some of them are obvious, some are not. But it's an interesting study of all the different procedures that are in place up there. Again, all under the guidance and all under the protections. And like I say, do a little, I'm sure you have, but do a little research. Bottom line is, there are a lot of businesses that have stayed open all the way through. They've survived. We didn't have chaos. We didn't have the Wild West. We had some that are a little better than others, but the other reality, we learned a lot. We learned a whole new vocabulary over the last 6 weeks. And people are respecting it more and more. Let's challenge each other. Let's challenge each other to come up with the safest practices, the best way that are economically feasible that we can afford to do as well. I get that. There's a lot of stuff out there you can take a look at that's successful and it does work.
And if you have some success stories, share them so everybody else can prosper from them.
You know, one thing we've done, and I think Jim and Dolly have both seen this, we did put a best practices document together. We did reach out to a lot of essential businesses, large companies that have been, doing business throughout this whole last couple months, and identified what they're doing. And there's great stories out there in terms of big companies with thousands of employees that have not had any single COVID-19 cases. So, you go to that document, we've been sharing it, it's online, but go to that document and see what they're doing. Because, we firmly believe the companies that go above and beyond, what they need to do will be winners in this in terms of confidence that their employees have, customers feeling confident and feeling good about going to do business there. I don't think it'll take some time for companies and to see customers return, because it's not until they feel like it's safe to go back in the water, will they go back in flocks. So it's going to take some time, but you need to develop and regain confidence in customers. But I do know there's a pent-up demand out there, and they want to come see you again. We have had a couple of questions that came in. I'll see if we can go through these. And either one of you can jump in on this. Jim, this is probably one for you, though. Businesses with less than 50 employees are not bound by FMLA regulations. Is that still correct?
They're not bound by the general FMLA, but they are bound by the newer FMLA, the expanded FMLA, and the 2 weeks, the new 2 weeks aspects they are. So otherwise not.
Yeah, the FFCRA, the Families First Coronavirus Response Act, has those two different kinds of leaves for it, and that law covers employees, or I should say private employers with fewer than 500 employees in the U.S. So the regular FMLA and Wisconsin FMLA, that's private employers who have 50 or more employees. All public agencies are bound by both the FMLA and the Families First Coronavirus Act. But the FFCRA has the 2 weeks or 80 hours of paid sick leave, and also an additional 10 weeks of expanded family medical leave, which is pretty much strictly for childcare issues.
I know another question came in. I know you brushed on this, but if an employee is found to be positive, what type of communication will that company receive from state or local health officials?
Sure. What we're seeing again is that keep in mind that the medical provider is the one that has the requirement to report that to the health officials. The health officials gather information as much as they can from the infected employee to say what kind of contact, was there a work environment, what was the others. You then may receive, depending on the degree of contact, sometimes it comes in a fax form, for example, but a communication as a follow-up from the health department folks as to what to do and some advice and some other suggestions with that. For example, in a setting where people have been working closer together and there was potential, they'll help the employer analyze what other employees they may need to contact, and then what information they would want to give to those employees. In another scenario I had where essentially it was individual truck drivers that didn't have contact with their colleagues. They pretty much drove their own vehicles. The health department wasn't as concerned about it. Again, there wasn't periods of time over 10 minutes that these people ever talked to anybody else. So they didn't have as much an issue of who to contact and what information to get to the other employees, but they had good information about cleaning vehicles, all the other follow-up to sanitize to make sure everything was safe for anybody else that was using the contact type of things that Dolly was talking about earlier.
We had a question that came in on the chat, and I think this may be going to Dolly, but going back to the recommendations on bringing back employees back into an office setting, can you expand on that a little bit more? I mean, I think maybe this question is getting to, is there some minimum things that people should be doing? You know, those sort of things.
Yeah, definitely some things to consider. Again, following the CDC, how are you going to keep your employees in the office separate? And so they have, are 6 feet apart. Whether that, if you've got a cubicle farm, then you might want to separate them. Like I basically lived in a cube farm, which is fine, but I was pretty close to my neighbors. And now when I go back, I kind of wonder, well, are we going to be, I'm not going to have my neighbor right next to me anymore. She might be 2 cubes down from me, things like that. So you get that, try to get that 6 foot distance, or maybe if you can't, partitions, plexiglass. We've been seeing more and more plexiglass come along. If you have places that where employees congregate, if you have conference rooms, you can just think of, well, do we want to just close them off and everybody's going to have meetings online? Or if you're going to allow them in the rooms, limit them to like 10 people per room, or depending upon the size of the room. A lot of it's just going to depend upon your physical work site, your business needs and things like that. But again, the CDC guidelines, basic ones that we went over, are usually a really good place to start.
Let me add a little bit to that, and Dolly mentioned it earlier, but emphasizing the sanitation aspect of things. Workplaces should be routinely cleaned and sanitized almost on a daily basis. Any contact areas that people are touching should be sanitized as best that we can on a daily basis. I was listening to an employer talking to a group of office employees, and they were doing a little training one time, and they said, respect each other, and part of that respect is going to be, this is an invisible virus and we don't know. We also know that there's a lot of people that may have no symptoms but may be positive and could be spreading it. And if you keep that in mind in respecting your work colleagues, assume that the person you're working with may have it but not the symptoms, and they're not doing anything wrong. Just if you do the sanitation things, if you do the social distancing, even if they were positive and didn't have the symptoms, it's protecting. And as we test more, we're going to weed out those scenarios where people may be positive and we don't know it. And we'll let the technology help with that. That's back to also testing for fevers, or temperatures, other aspects of other places. But I thought it was interesting, just as a practical suggestion, is if somebody came to work with the flu, we'd send them home, of course. If somebody was sneezing or others, we'd send them home, of course. But respect it's an invisible virus, and everybody, your neighbor might have it in your work cubicle. Respect it, stay away, help each other out.
I think we have time for one last question here. It's a FLSA question. Is there any exception from the COVID-19 related law that allows an employer to reduce exempt employees' pay and have them work reduced hours? I think, Jim, it might be you.
Well, there isn't anything unique to the law that's going to let us change what's going on as far as that goes. If you got an exempt employee and you're going to have to pay them the salary, and you may have an expectations of work, you're going to have those exempt salary minimum requirements, and you may have certain hours that go with that. Essentially, you'd be changing the job if you change the salary and the hours requirements. You still gotta, again, you gotta make sure you're paying the minimums required. You gotta pay on a salary basis, and you gotta make the duties test to make sure the duties are still all in play. Is it possible? Yes. Is that different from before? No.
I haven't seen any changes to the Fair Labor Standards Act in that regard because of the COVID-19 outbreak.
No.
Okay, well, we are at the noon hour, so I think we'll conclude. Dolly, Jim, thank you very much for joining us. Well done. This has been recorded. We will have this online. We'll get it out to members as broadly as we can. We're just, as Jim was saying before, we're telling people to prepare, be ready. I know the preparations have been going on for 2 months now, ever since the shutdown order came, and people are anxious to get back to work and to open up their business again. We fully expect that to be next week. So, there's plenty of resources out there on our website, CDC, OSHA. I mean, there's volumes of stuff there. So, please avail yourself to that. Do what you need to do, be responsible about it, and let's get this thing going again. So again, with that, thank you, Jim. Thank you, Dolly. And we will we'll call it an end. So thank you very much for joining us today.
Thank you for the opportunity.
Yep.
Thank you. I know.